Hello, everybody. My name is Christina Levitas. I'm here with Dr. K, and we are excited to announce the RSNA Spotlight course, Expert Insights on Emergency and Abdominopelvic Imaging.
In Istanbul, Türkiye.
So we're both gonna introduce ourselves. We're gonna start with Dr. K.
Thank you, Chrissy. This is Muşturay Karşıaltıncaba. I'm a professor of radiology at the Hacettepe University Hospitals in Ankara, Turkey. I did my fellowship in Milwaukee at the Medical College of Wisconsin. Right now, I'm working as an abdominal and cardiovascular imaging radiologist. But my area of expertise is liver imaging. I love teaching and giving lectures.
Fantastic. My name is Christina Levitas. I'm an associate professor at Boston University, Boston Medical Center. I completed a fellowship in abdominal imaging at Beth Israel Deaconess Medical Center in Boston. And in my current role, I am an abdominal imager as well as an emergency radiologist. My areas of expertise are in both of those domains, and most of my clinical research is focused on emergency radiology. So we're now going to turn to the curriculum, what to expect when you join us in Istanbul. As an example of the type of emergency radiology case that we're going to be highlighting, I'm going to share my screen and we will discuss one. So this is an example of an emergency radiology case seen at my institution at Boston Medical Center. This is a 33-year-old gentleman who was in a motor vehicle collision. On this CT scan, which I'm going to highlight here, we have multiple axial contrast-enhanced images which demonstrate left-sided rib fractures. There are multiple levels. They extended from the 5th through the 8th ribs. We roll through the solid organs. He also has a displaced right femur. So I've highlighted this case for a couple of reasons. I wanted to first focus on a very important and hot topic in emergency radiology, which relates to the phase of contrast with which the CT scans are acquired. The AAST 2018 revision for splenic, renal, and liver trauma includes some guidance for us as emergency radiologists on which phases of contrast to acquire the CT with. In this document, which was published by the AAST, they recommend that we use both a late arterial phase and a portal venous phase through the solid organs in the upper abdomen. And this case highlights the reason why that's so important. So while the imaging findings of fractures were made, the finding that was missed on this examination was in the spleen. You can see on the edge of this CT that the patient's right arm is down. He had injured his right shoulder and was unable to hold it above his head, as we classically do. So this CT scan was acquired at the outside hospital, which is in a place called Cape Cod. It's a beachside community. And he was actually flown in by helicopter to see us. So I'm going to fast forward to the end of the story and then I'll back up to the CT scan. So the patient was in-house at Boston Medical Center, did fine. His hip injury was fixed and he was sent home to Cape Cod. Unfortunately, about 3 days later, he re-presented to the outside hospital in hemorrhagic shock. So what was missed on this CT scan was a laceration along the inferior pole of the spleen. You get hints of it here. There is an associated vascular injury in this splenic laceration. It is a little bit difficult with the beam hardening artifact from the patient's arm being by their side. So the point of this case and issues that we highlight on the second day at the Spotlight course are the importance of the CT IV contrast phases on trauma imaging. Had we had a late arterial phase through the upper abdomen as recommended by the AAST, we would have perhaps caught the splenic laceration and the vascular injury more easily. So unfortunately, since this examination was acquired in only the portal venous phase, this injury was missed, and the patient had a delayed splenic rupture from this missed injury. At the time he presented again to the outside hospital, he was again sent by helicopter to us. He underwent a successful splenic embolization, treating his splenic rupture. So this is just one example of a trauma case, and we're really going to flesh out the best practices when imaging this patient population as they can, save the patient's life. Dr. K and I were just reviewing the registration to date. And Dr. K, could you remind me how many countries will be in attendance at our meeting?
So far, more than almost like 20, and from 5 continents. So we're really glad to have a global coverage.
Global community convening. I find I learn the most at these smaller conferences where I get a chance to discuss with other radiologists, the speakers who are at the same coffee station as me. We're excited to offer this course, the Expert Insights on Emergency and Abdominopelvic Imaging. It's an RSNA Spotlight course. We have 12.5 CME credits available. We hope that you'll join us where Europe meets Asia in Istanbul. If you have any questions, please feel free to reach out to customer service at rsna.org. Dr. K and I are excited to meet with you, to learn from you, and to share our knowledge as well as the knowledge of our expert panel. So yes. Look forward to seeing you in Istanbul.
We wait you.